Our mission today is, well, to cut through some noise and look at a really high-stakes issue in India, the money side of healthcare. It's ethically tricky.
Yeah, it really is. And you can't talk about India's growth without talking about health. Good health underpins, economic stability.
But the system's struggling.
Massively. It's under incredible strain. And it's not just the diseases we used to focus on. Now it's chronic conditions, NCDs, non-communicable diseases. They're a huge burden.
Things like heart disease, diabetes, the long-term stuff.
Exactly. Stuff that needs ongoing, often expensive treatment, not quick fixes.
Right.
I mean, even back in 2005, these NCDs were responsible for 40% of hospital stays.
40%. Wow.
And over half of all deaths, 53%. And that burden, it's only growing with, urbanization, changing lifestyles. It's putting huge pressure on resources.
Okay, so let's unpack what our sources are pointing to here. Because it's not just about not having enough beds or doctors, is it? There seems to be a problem with the financial structure itself, particularly in the private hospital sector.
That's a key part of it, yeah.
We're hearing about these, perverse incentives, systems that seem to push doctors to focus more on cash flow, the money coming in, than maybe on what's best for the patient.
It's a systemic issue. It feels like we've shifted in some areas from a focus on healing to just transactions. The financial model, especially in some of these big private hospitals, it's aggressively designed to, encourage more treatment, maximize the profit.
Can you break down this commission model we've read about?
Yeah.
How exactly does it tie a doctor's pay to the money they bring in?
So many contracts, especially for specialists like surgeons who are in high demand, they don't actually offer a steady, fixed salary.
No regular paycheck.
Or not entirely. It's often purely fee-for-service, commission-based. The doctor is essentially treated like a salesperson.
So if they order more tests or do more procedures, they personally earn more. They get a slice of that revenue.
Precisely. The examples our sources give are stark. Say a doctor generates 1 lakh rupees in revenue for the hospital, that's 100,000.
Okay.
They might get a 20,000 rupee commission from that. If they manage to generate 2 lakhs, maybe they get 40,000. It's a direct percentage cut.
Yeah.
It's fundamentally a sales structure, not really about clinical accountability in that sense.
That just screams ethical conflict, doesn't it?
Yeah.
Doctors take an oath, but then they're paid based on hitting targets. Are these doctors, you think, intentionally doing harm, or are they maybe caught in the system themselves? Pressure to perform.
I think it's often the latter. You have to remember the sheer cost of setting up and running a modern private hospital in India. It's huge.
Right, massive investments.
So those hospitals need massive revenues just to stay afloat, to pay back investors, and the doctors they hire. They inevitably become part of meeting those financial targets. It creates this high-pressure environment where sometimes clinical judgment might take a back seat to hitting the numbers. That pressure can, force bad behavior.
And what does that bad behavior look like for the patient? What are the specific outcomes?
Well, the outcomes can be tragic and very costly for families. This pressure can lead directly to unnecessary procedures, extra tests, scans that weren't strictly needed.
Hospital stays too, operations.
Sometimes, yes. Unnecessary hospitalizations, even operations. And the main driver isn't always clear clinical need. It's the push to increase cash flow, boost the hospital's bottom line, and by extension, the doctor's commission.
So families aren't just paying for care, they might be paying for deliberate overtreatment.
Just for profit.
And you see evidence of this in the billing too.
How so?
Well, sources mention patients getting wildly different bills for the exact same treatment, from the same hospital even.
Curious. Yeah. Which suggests the price isn't just based on standard clinical needs. It's more like an assessment of how much money can be squeezed out of this particular patient or their insurance.
Wow. It's like a constant calculation for maximum extraction.
Sort of, yeah. A sales incentivized approach running underneath the medical care.
And the impact on families? I mean, for many ordinary Indians, a big hospital bill, especially for a chronic condition, it could mean total financial ruin.
Absolutely. Bankruptcy. It completely goes against the whole idea that medicine should protect the vulnerable, the poor, the voiceless.
Like an ethical breakdown wrapped up in a business plan.
You could say that. A problem rooted in high costs and a profit motive that can lead to really poor outcomes for patients.
Okay, so that's a pretty grim picture of the problem. A huge entrenched system. How do you even begin to disrupt that without, say, building an equally massive public hospital network? Which brings us to the potential disruptor, Dr. Maya GPT.
Right, Dr. Maya GPT. It's designed specifically to challenge that whole profit-driven status quo.
By empowering the patient.
Exactly. It flips the power dynamic, gives knowledge and guidance directly to the patient, reducing their reliance on that potentially exploitative hospital system.
So what is it exactly?
It's an AI-powered health assistant, multilingual, which is key in India, and it acts as a triage system. The goal is to democratize health guidance, make it accessible no matter where you live or how much money you have.
And the interesting thing is how it thinks, right? It's supposed to be more like an experienced doctor than those standard symptom checkers online.
Yeah, those old symptom checkers. They're notoriously bad, often just causing panic.
Making everyone think they have a brain tumor.
Pretty much, because they use these rigid yes-no questions, like a flowchart. They can't handle nuance or see how symptoms connect.
And the accuracy reflects that.
Oh, definitely. Studies show those checkers give the right advice maybe 19% to 54% of the time. Often, they just generate fear and unnecessary ER visits.
Okay, so how is Dr. Maya different? How does it get closer to actual clinical thinking?
It uses a different approach. A 3-symptom triad. It's based on pattern recognition.
Okay, pattern recognition.
Yeah, so instead of asking, do you have a fever? Yes, no. The AI looks for a specific combination of 3 key symptoms that are weighted.
Ah, like how a doctor quickly puts pieces together.
Exactly. An experienced doctor doesn't just look at one symptom in isolation. They see the pattern, how things fit together to suggest a particular condition or syndrome. Dr. Maya tries to mimic that, looking for correlations, not just isolated data points.
How does it pick those 3 symptoms? Is it looking for known risks or just crunching numbers?
It's a bit of both. It's trained on huge amounts of clinical data, so it learns which specific cluster of symptoms is most predictive of something serious or something contagious. It's filtering out the noise, basically.
Focusing on the most meaningful patterns.
Right. And by focusing on those triad-flagged cases, the ones with the strong patterns, the accuracy just skyrockets.
And the numbers are pretty impressive there. What did the studies show?
For those triad-flagged cases, the accuracy in giving the right guidance jumps to between 81% and 95%.
81 to 95%. That's huge. That's a potential game changer if you're sitting at home worried, wondering if you need to drain your savings for a hospital visit.
It really is. And crucially, the goal isn't to give a definitive diagnosis, and AI shouldn't do that.
Right.
The goal is immediate, actionable guidance. And maybe just as importantly, reducing that crippling anxiety that can actually make symptoms feel worse and push people towards unnecessary care.
And to make that guidance clear, Dr. Maya uses a color-coded system. Can you walk us through those colors? How do they help with costs and community safety?
Yeah, the clarity is key. So first you have red.
Okay, red sounds serious.
It is. Red symptoms mean immediate action. The AI tells the user, call an ambulance, go to the hospital. Now, it makes sure truly critical cases get urgent care.
Got it. What's next?
Then there's yellow, and this is where you see huge potential for cost saving. Yellow symptoms mean the condition is likely manageable.
So not of urgency.
Right. The advice is maybe talk to your local pharmacist, your chemist, or call a community triage line if available. This stops people rushing to the doctor or ER for things that can be handled simply, saving money and stress.
Makes sense. And the last one, blue. That sounds important for public health.
Blue is vital, especially in densely populated areas. Blue symptoms indicate the illness is possibly contagious.
Ah, like flu or something worse.
Exactly. So the guidance is isolate. Don't travel, don't mix with others. And it connects you to local public health information. This is critical for stopping community spread, not just of colds and flu, but potentially more dangerous things like superbugs.
Antibiotic-resistant ones.
Yeah, which often spread in hospitals.
Right.
So by advising early isolation for blue cases, you protect the community and you keep people out of the hospital system unnecessarily. Reduces spread, reduces cost. It's a double win.
So this whole system, the red, yellow, blue triage, it directly pushes back against that financial problem we talked about earlier, doesn't it?
Absolutely.
If Dr. Maya helps people manage yellow and blue cases appropriately at home or with minimal intervention,
It cuts down that artificial demand for expensive hospital services. It directly reduces the number of unnecessary referrals.
is there data on that? How much it reduces referrals?
There is. A prototype study showed a really striking result, a 55% reduction in unnecessary referrals.
55%. That's more than half.
More than half of the people being sent on for further care who didn't actually need it, based on the AI's assessment. Think about what that means.
Well, it directly undermines that commission model, right? If
Yeah.
doctors are seeing 55% fewer patients who were just scared or didn't need to be there,
Then the pressure to order extra tests or procedures just to make money should decrease significantly. There are simply fewer opportunities built on unnecessary visits.
And that's how you start to prevent families from going bankrupt over healthcare.
It's about giving people back some control, reclaiming their decision-making. It helps manage the fear of infection, the fear of high costs, and reduces dependency on a system that can sometimes profit from that fear and lack of information.
You'd think an innovation like this, effective, empowering, cost-saving, would be snapped up by health organizations everywhere. But the inventor apparently faced a lot of pushback. Resistance.
Yes, significant resistance, which seems counterintuitive, right?
Completely. Why would anyone resist something that seems so beneficial?
Well, you have to think about who benefits from the current system. Dr. Maya is decentralized. It's designed to be free or low cost. It gives knowledge directly to the patient.
Which threatens the status quo.
Exactly. Established medical institutions, whether they're public bodies used to top-down control or private hospital chains focused on revenue, they have a vested interest in keeping things as they are. A tool that could potentially reduce patient foot traffic by 55%. That's a direct threat to existing power structures and, frankly, profit models.
So just to recap our deep dive today, we've looked at this deeply worrying system within parts of the Indian hospital industry, where these commission-based financial models seem to incentivize, even force unnecessary tests, scans, hospital stays, even operations.
Leading to potential financial ruin for patients and families, a system driven by cash flow as much as clinical need.
We contrasted that with Dr. Maya GPT, an AI tool using sophisticated pattern recognition, not simple checklists.
To provide accurate triage guidance, empowering patients, reducing anxiety, and demonstrating a huge potential, that 55% figure, to cut unnecessary referrals and costs.
The core tension here is really stark, isn't it?
It couldn't be clearer. You have AI basically proving that ethical, pattern-based clinical reasoning, even simulated, is superior to these flawed, profit-driven algorithms dictating care in some places.
And the resistance the inventor faced just highlights how hard it is to change entrenched systems, especially when money's involved.
Powerful institutions often resist innovations that threaten their control or revenue streams, even if it benefits the public.
Which leaves us with a final thought for you, our listener. India has this goal, right? To be a developed nation by 2047.
A major ambition.
But can it realistically achieve that with the current cost of healthcare? Where a single illness can wipe out a family's savings? It seems unsustainable. Maybe the future isn't just about building more hospitals. Maybe it's about fundamentally shifting the power dynamic.
Dismantling that dependency model.
Exactly. Giving usable, reliable knowledge of health back to the people. Could that be the real revolution? Making the most expensive and, frankly, unethical parts of the current system? Maybe just obsolete.
Our brain doesn't know the difference between an actual experience and an imagined experience. If I anticipate illness, infections, or surgery, and I'm afraid of cost, hospitalization, surgery, complications, and even death, I'll release the same flood of hormones as the surgical procedure or death. If I think about walking on a beach in Barbados, our pupils will constrict and we may start sweating. If I think I'm in the dark cave, the pupils will dilate. So every wisp of thought releases a flood of hormones and chemicals and chemical messengers, and every little cell in your body is eavesdropping on that. In fact, your body is nothing other than the projection of your own consciousness. We experience ourselves objectively as the body. We experience ourselves subjectively as the mind. And actually, whatever we are experiencing is an aspect of our own self. Fear doesn't always come from reality. Sometimes it's imagined, but your brain doesn't know the difference. Maya is a powerful tool designed to help you recognize and interrupt fear-based thoughts before they spiral out of control. Whether it's a sudden ache, a racing heart, or a cloud of what-ifs. Maya listens, teaches your mind to pause, reflect, and respond with clarity, not panic. We often confuse fleeting sensations or emotions with something more dangerous, and that thought alone can hijack your body, flooding it with stress hormones, anxiety, resulting in wasted visit to consult a doctor. But here's the truth. No doctor can say, "No, your thoughts shape your chemistry." Your chemistry shapes your reality, and Maya helps you take the wheel. By bridging the gap between imagined experiences and actual reality, remove the veil of illusion, Maya. Stop listening to the lies, seek the truth, and know the truth. It's not about ignoring the signs, it's about reclaiming your power over what they mean. With Maya, you'll learn to interrupt spiraling thoughts before they become fear. Separate what's real from what's imagined. Build resilience and clarity in moments of panic or uncertainty. Reconnect with your body as a friend, not a threat. It's not about fixing, it's about waking up to what's already within you. Don't let fear decide your story. Download Maya AI today and experience a new way to think, feel, and be. Thank you.
Download Maya AI today and experience a new way to think, feel, and be. Thank you.